When you picture a narcissist, you might think of someone who is grandiose, attention-seeking and arrogant, also known as overt narcissism. However, there's another, less obvious type of narcissism as well, covert narcissism. These types of narcissists may show fewer outward hallmarks of the disorder, making them more challenging to identify, but they still have an excessive need for attention and admiration and generally lack empathy for others. Welcome to our deep dive into the complex world of overt narcissists and covert narcissists. In this video, we unravel the enigma of individuals who exhibit covert narcissist tendencies versus overt narcissist tendencies, exploring the delicate balance between compassion and ego. Join us on this introspective journey as we uncover the contradictions inherent in overt versus covert narcissism. What is a covert narcissist? Covert narcissism, also referred to as vulnerable narcissism, and has been described as the more silent and subtle variation of narcissism. This type of narcissist shares the same overarching traits of the personality disorder and inflated sense of self, a lack of empathy for others and an excessive need for admiration and attention, but manifests these traits in a less obvious way. Differences between covert narcissists and overt narcissists. People with overt narcissism tend to display a high level of self-esteem and extroversion, while those with covert narcissism tend to have a lower sense of self-esteem, which may result in defensiveness, feelings of insecurity and self-consciousness. Still, covert narcissists maintain an inflated sense of self and lack empathy for others. Further, covert narcissism has been found to have a higher correlation with introversion and neuroticism, whereas overt narcissism is generally more correlated with extroversion and higher levels of agreeableness. There may be varying levels of self-awareness between covert and overt narcissists. People with overt narcissism may not have any awareness or insight into their behavior, but those with covert narcissism can actually be capable of empathy and having conscience, even if only for a limited time. Causes of covert narcissism. The exact cause of covert narcissism remains unknown, though some studies have suggested there may be a genetic predisposition toward the disorder. For the most part, however, personality disorders like covert narcissism are not genetic. Childhood trauma and a person's sensitivity to that trauma may lead to more severe disruptive behavior or defenses, such as covert narcissism. Indeed, environmental factors like stress or childhood experiences, including negative interactions or excessive praise, are suggested as possible causes that can lead to narcissistic personality disorder. Other potential contributing factors include personality, temperament and neurobiology, which is the connection between how someone thinks and how they behave. Signs of a covert narcissist. Covert narcissists display the same core traits as overt narcissists in terms of inflated self-importance and a lack of empathy for others. However, there are distinct traits of covert narcissism, and the underlying pathology displays differently. Individuals may display varying indications of covert narcissism, but, in general, these are common covert narcissist signs. Covert narcissism has been found to correlate highly with introversion. This diverges from overt narcissism, which usually involves more grandiose displays and extroverted behavior. Rather than acting in a brash, direct way, the covert narcissist may display a quieter sense of superiority and appear more reserved. Self-consciousness and social insecurity. Those with covert narcissism may have a tendency to feel like the victim, which in a way displays their sense of their own exceptionality and superiority. Covert narcissists are often highly sensitive and may have low self-esteem, which may lead them to seek frequent validation from others. Those with covert narcissism also tend to be highly sensitive to criticism and may be more likely to internalize it due to their fragile sense of self. Defensiveness and anger. Covert narcissists are more likely to display narcissistic rage, a tendency toward hostility and anger. Research suggests this is because covert narcissists tend to be highly neurotic, whereas overt narcissists are typically more stable emotionally. Passive aggressiveness. Overt narcissists tend to seize the spotlight, but covert narcissists are more likely to stay on the sidelines. Covert narcissists may be more passive-aggressive in their interactions, communicating through guilt trips, giving backhanded compliments or telling veiled, hostile jokes, and may prefer to fall back on avoidance tactics rather than deal with conflicts directly. Gaslighting. Gaslighting, a form of psychological manipulation that causes the victim to question their own perceptions, thoughts and memories, is a hallmark covert narcissist tactic. Narcissists have a tendency to project the blame on other people, and you may get a sense that what's going on doesn't quite make sense. Look internally. If your reaction to a person is basically being gaslighted, surprised and shocked that this is going on, that's a good reason to take a good look at both sides of the relationship. How to deal with a covert narcissist. When interacting with a narcissist, the best defense is to set firm, clear boundaries. Realize that when you're dealing with a narcissist or someone whose narcissistic traits are coming out, at that time, you're not going to get very far with reasoning with them. You just have to set boundaries. You cannot reason with someone when they're in a state where all they care about is themselves. While an individual is in this state, it's best to simply stick to your boundaries and allow yourself a healthy amount of space. Depending on whether the person expresses awareness of their behavior, you may be able to have a conversation to address the situation and advocate for yourself. When to ask for help. If you're struggling to deal with a covert narcissist, or if you suspect you might be a person with covert narcissism, it might be wise to seek professional help. Working with a mental health professional can teach you more about what to expect in the disorder and how to set limits in relationships. The good news is that narcissistic personality disorders are treatable conditions, and there is always hope for improvement. The key is to focus on what you can control. If the other person's behavior triggers anxiety, depression, misplaced guilt or a loss of self-esteem, that means they're hitting your weak points. You're not going to change them, but getting professional help can make it so you're not as vulnerable to feeling badly when they're acting out. Thank you for joining us on this journey of discovery, and we look forward to continuing our exploration of psychology and human behavior in future videos. If you find the video content informative and helpful, please like and subscribe.